So before I walk you through my presentation, I would just like to give a small story about what actually kept left a mark in my life. So I come from Northeast India, and I come from a family of physician. My father was a pediatrician, so at home he always spoke about like breast milk to be the best, immunity we give to a baby. So all this year, like while growing up, that's what I heard. There was no like it was always an open discussion. So when I was 12-year old, my one of my friends' mom died, and I went for the funeral. Over there, I asked like, how did she die? And even to utter the word cancer, it was a big taboo. So I kept asking then, like where the cancer developed, and the family didn't want to disclose. But when I insisted, they said breast cancer in a very hush hush way. So I repeated like breast cancer. They like, you're not supposed to talk about it. So I really felt very, it was so hurtful for me that one of my friend's mom died, and this is the respect you are giving to a mother. We lost her that we can't even discuss about what caused her life. So eventually my career went into the role of it as a breast cancer scientist too. But then when I would be meeting the oncologists, they would always tell me that still, with the breast cancer scenario, the detection is late because women present so late. So that was the first, I felt that it's so important that we generate the awareness. We have to break the breast taboo and discuss more about it, because until and unless we translate the information to our community, because it's not only the taboo, it's the ignorance too, that women are not aware the painless or painful lump could be cancer. So that was the creation of Breast Cancer Hub, and now I'm going to walk you through my presentation so that we can get a consolidated idea that after our session today, each of us will be empowered, and you can advocate yourself. It will be like a ripple effect. You break the taboo in your network, and you will be able to step up to help save lives. So that is the purpose of the session, so that it doesn't restrict over here, but it will be a take home message, and it will begin in your own home. Now, before I go into the details, I always start with a tribute. So they are our breast cancer hub advocates, and we lost them in 2018 and 2019. So you see over here, Lotika Das. Her brother-in-law is my friend, and we grew up together in India. But her brother-in-law Shantanu lives here in Charlotte. So when actually the situation was that when he went to meet her, we understood that she her reaction was she did not know that a painless lump in the breast could be cancer. So just imagine if that information would have been passed to her, then she would have been alive today. So you see here the women Manjit. I met Manjit in 2018 in August. The enthusiasm she had, she wanted to leave, but she was detected late. Then Janaki, they all had this enthusiasm to leave, and they are the fighters. So we always celebrate the lives of the heroes who left us, because they are our inspiration to keep our fight going. Now, when we think of these women, we always like when I first started Breast Cancer Hub, the reaction was that, yes, Lopa, you need to go to the villages in India. But then just imagine they all are educated women. So the problem is not about the rural sector only. It's not only the financial constraint, it's the cultural, it's the inertia that we do not discuss any issues in the breast, and even the socio-economic condition, the education, irrespective of that, women give, that their health becomes the back seat. And also, even if we can financially afford, but we will not go for the screening. Screening means when there are no symptoms, we are going for a mammogram that I'm going to talk about. So mostly the detection is diagnostic. That means when we are having the concerns, we are going to the doctors. At that point, the tumors are pretty big and gets advanced. So the earlier we can detect, the better the prognosis is. So saying that, I would like to switch gear a little bit and go to the male breast cancer now before I go to the screening, because the screening that I'm going to talk about is applicable for both women and men. Now, according to the statistics, we all know that whenever we think of breast cancer, we are thinking of pink everywhere. But I always say that let's bring a touch of blue also. So that's why our logo has always has a streak of blue in there, and four ribbons together means we all come together to fight for the cause of cancer. Now, with male scenario, the situation is worse than women, because men feel it's a woman's disease and they are more shy to talk about it. So, for example, one of the stories I heard in the man scenario, he told me that he didn't, his children did not even want to tell their friends that their dad has breast cancer because their friends are going to laugh at them. So that is so sad. And one of the person from Nepal, he reached out to me saying that I really want to work on male breast cancer. And when I asked the reason, he said, my senior in school, he was 18-year-old. He was detected with breast cancer, and everyone started to make fun of him. It was a taboo, and then he committed suicide. So we should not ignore the male scenario. So that's why, I always, so we from breast cancer, how we collaborate with Male Breast Cancer Coalition. And if you see Brett Miller here, the picture, he fell the lump at the age of 18. So that means that we really have to, do the screening process for the men. It's not only that later in the age, but young men can also get breast cancer. The other situation here, I want to give an example of Marlene Washburn. His wife Patricia is right here next to me. So Marlene was fighting for breast cancer for his daughter, but he did not know. He was a principal in the US in a school. He was super educated person, but he did not know that he was having breast cancer too. When detected, we had him only for 5 months. So this is the scenario with male breast cancer. We are doing a lot of study now on the male breast cancer research, because with breast cancer hub, the other intent is to bridge the gap. Wherever I see the challenges, we're trying to go into there, because whatever research we have been doing in the lab, we are always doing on the female transgenic model, the preclinical study, the clinical study. And what is happening is with the male scenario, the recurrence, the treatment is not as much working, because we are using the same treatment that we use for females, we are using it for male, but there are a lot of hormonal changes. There are a lot of other factors, that play a role. So that's why, we always bring in the male scenario equally as we talk about the female, though the frequency is 1 out of 833 men. But I always say that that man is a father or a son or the brother of a family. So how can we ignore them? Now, next we will go to the screening process. But before that, I also want to share, like, how do I know that, what are the basic challenges which is being faced? So what I did was I went through all across India. I was meeting all the survivors or the patients, and what I understood was that lot of times the impression was that no one in my family has breast cancer. So why, even like for example, this woman here, she is a school teacher, and she told me that she felt the lump for a long time, but no one in her family has breast cancer, so she totally ignored. So the other scenario that I faced was that, the same thing, that I was so shy to tell anyone. So that's why I did not want to disclose even to my daughters. I have two daughters, but still I didn't want to disclose. So these are the different things going on. So from today, after today, I would request, like, please take the phone call. If you are from the US, your family is in India or other countries, tell your mom, tell your aunt, tell your grandma to do the screening process. Even when, if you're a son, you have to speak up to your mom, or, just don't be shy, because that's the first step. Now, what is the statistics, right? So the statistics goes like this. That is, we all know 1 in 8 women can get breast cancer in their lifetime. But then, as Dr. Padma said, that it's not only in the developing countries. In the US also, it is very essential, because according to the American Cancer Society, we are still expecting this many deaths, estimated death to breast cancer. That means the situation is pretty grim. But then we all know that in the US, the early detection is significantly higher than the developing countries. And also, we should be knowing that we all mostly go for a mammogram, which is the standard for breast cancer screening after the age of 40. But then why, there are still late detection, or what actually happens? Why the progression of the breast cancer from early stage to the late stage? So I'm going to touch a little bit over this challenges too. But in the developing countries, the death rate is significantly higher. Now, when I say that, when I'm looking up for the data on the internet, what I find is that 60% is the survival rate in India or in other developing countries. But when I'm actually going to the rural sectors or many repositories in the urban sectors, I see like it is 90 to 95% death rate. But where is this data represented? So what I'm trying to say is that what we see actually representation with the breast cancer scenario may not be the true depiction. So that's why it's alarmingly increasing, and not only in the older population, but also nowadays in the younger population, breast cancer is significantly higher. So, but when detected early, breast cancer is totally curable. So, what is the detection process, right? So, that is what we are going to talk about, the breast cancer screening. Now, this one particular slide, I tried to compile everything, and then I will go into the challenges again, like limitations to mammogram. But what is the screening process? So, from the age of 17 to 18, we really have to do the breast self examination. That means that we have to understand, and I'm going to walk you through how to do the breast self exam. We have to understand the look and feel of our breast to detect any abnormalities. Basically, like for example, how do I know how many white strands of hair I have? Because I am observing. In the same way, we have to be very vigilant about the look and feel of our breast. Now, that goes as the self breast exam. But then, what is the standard? The standard says that we can go for mammogram after the age of 40. That means from the age of, like when I turned 40, doctor, gynecologist told me you have to go for mammogram. I started to go for mammogram. Like it is my choice from the age of 45 to 54 every year, and 55 and above every 2 years. But then what happens to the younger population? And even when we have mammogram is once a year. But then a lot of women, they told me that they had their mammogram and they were so relaxed and relieved that they don't have to worry. But then they felt a lump eventually in 6 months. So what I'm trying to say is that for the population, younger population or the older population, we have to do the breast self exam every month. And then we also have to go for a physical. That means we go to the doctor and the doctor does our clinical breast exam, which is very significant and important because this helps to detect many lumps. Now, saying that, when I'm talking about the developing countries, and I told many doctors in India, so many gynecologists who are women, they told me that this is the reaction. Why are you touching my breast? Nothing is wrong in my breast. I came for a situation in my reproductive organ. And the male doctors told me that it's very difficult to examine a woman's breast when they have come for some other concern. So that means that there is a cultural stigma over there. And my point is that we cannot complain all the time and we cannot break this taboo in one single day, but we have to provide a solution. That's what I'm going to talk about. But before going that, I also want to mention that though the protocol, the standard is that above 40 we have to go for a mammogram, but what happens to the population who are at high risk? That means that they have a family history of breast cancer. So do we ignore them totally, or what do we do? Because mammogram at the age of 40 may be too late for them. So who are at high risk? So that is very important that we understand the genetics of breast cancer and ovarian cancer too. So when in a family we have breast and ovarian cancer running, for example, the first relative like aunt, mom, grandma, or the cousins, then what we do is we call this as mostly the hereditary breast and ovarian cancer syndrome, and we go for the genetic testing, which we call as the BRCA1 and the BRCA2 mutation testing. Now, when I say that, 5 to 10% of all cancers are inherited. That means 80 to 90% randomly this can happen to anyone. So it's not that, if I'm not having anyone in the family, I shouldn't worry. I should be concerned at all conditions. Now, when I'm thinking about the genetic mutation, the problem that I see is we are always thinking about the females. But we cannot forget the males, because the father can also be the carrier, or they may be expressing the genetic mutation of BRCA1 or BRCA2, and this can be carried to like 50% chances to the son, or it can affect the daughter also. So it's very important that if you know anyone having a family history, we should always recognize the man also equally as we recognize the daughter. We should also recognize the son to go for the testing, because that boy may not only be susceptible to breast cancer, but also to prostate cancer, pancreatic cancer, and other types of cancers too, so because they have the promoter now to develop cancer in all these organs. Now, is it only sufficient with the BRCA mutation? So I have seen many cases. They told me that, I'm so relieved my BRCA mutation is negative. But we should also know there are other high penetrance genes also. So I have stated over here, and there are moderate penetrance genes. So I always request everyone to do the panel, because when we have this moderate and the high penetrance genes beside the BRCA mutation, we are susceptible to breast cancer. So that means that population is vulnerable. For the male scenario, what are the reasons they can get develop the breast cancer? So of course, the BRCA mutation, the high penetrance and other moderate penetrance genes, but there are other risk factors, for example, the aging, the radiation exposure, because I don't know if you know this area in North Carolina, the Camp Lejeune, there are a lot of there was a seepage disaster of arsenic radioactive materials which caused cancer in every household almost. And then many have developed breast cancer. Also, there are many men I know developing breast cancer who work in the atomic like industry places. So what I'm trying to say is radiation exposure is important, that men may develop. Alcohol consumption of alcohol, some liver diseases are also leading to breast cancer in men. Hormonal treatment, obesity, which causes underlying inflammation, can also lead to the breast cancer. Testicular conditions, guys, then also the gynecomastia, when the males have more tissues. And there are other two signs which are called the Klinefelter syndrome and Cowden syndrome, which leads to the development, they're at high risk for male breast cancer. So it's very important that if you know this population, that we please become aware. And of course, this is the family history, the genetics, but also the other situation with the male breast cancer. Now, so these were the high risk population, right? So for the both females and the males. Now I'm going to talk about the screening that we always know that the gold standard for breast cancer screening is the mammogram. But then did we know that mammograms can also miss breast cancer? So she's Dr. Nancy Capello. She did her mammogram in the year 2004, and her mammogram came as a happy mammogram. There were no concerns. Now, one good thing in the US is that we go for a physical in the same way she went for a physical. Doctor did the clinical breast exam, and they felt a big lump. And then when she did MRI, it came as stage 3C. That means it was pretty advanced. Now, her situation was she was so upset. She said, "What happened? I did my mammogram religiously, and the doctor said you have dense breast." Now, because of Dr. Nancy Capello, we lost her in 2019, but because of her, now all the states in the US, we get this letter that what kind of tissue we have. So what is this dense breast and why I'm talking about this? Now, this is the mammogram, which is the low dose X-ray of the breast. Now, here, when we have our breast mammogram or the X-ray, it usually appears as a black background like this because our breast tissues are made up of mostly fatty tissue. But we women, we 60% of the chances times we also have, in addition to fatty tissue, fibroglandular tissue, which we call as dense breast. Now, when we have dense breast, it appears as a white patch like this, and when we have heterogeneous dense breast, it's scattered, and homogeneous means it's totally dense breast. Now, why am I talking about this? Because when we have cancer or lesion, it appears as a white spot. It is basically finding a snowflake in the snowstorm, and that's how we can miss the cancer. So what are the additional tests? Like, for example, what I'm trying to do is working with the healthcare system also now, if we can make some changes to the healthcare policies. Now, in the US, the regular mammogram is becoming redundant. So what we are doing is more on the 3D mammogram. 3D mammogram or tomosynthesis. That means that, when I would request, when you're going for your mammogram, you hit the age 40, you go for mammogram, please request the doctor, the radiologist, if you can go for 3D mammogram because it gives better resolution so that you can diagnose dense. So dense breast, we only know through mammogram, but 3D mammogram is a better resolution. But many times 3D mammogram can also miss it. So at that point, what is an additional test? We can do breast ultrasound or MRI. So this particular slide has saved so many lives in the US and in wherever globally I'm doing webinars every day. And this is an eye opener because many patients told me that they were feeling the lump growing, but the mammogram came as negative, and then they pushed towards ultrasound and it came as positive that they were having the tumor. Because in India, for example, if I'm talking about mammogram and if I talk about 3D mammogram, that's not as much applicable. So when I'm talking, I have to think about all the scenarios. At that point, I tell everyone, when you go for your mammogram, ask your doctor if you have dense breast. If you have dense breast, additionally, you do an ultrasound. And the doctors are actually stepping up and doing both in parallel, so which is really, really helping. And in the US, that is what I tell that, because mammograms can miss 50% of the cancers if we have dense breast. So better to go for 3D mammogram. And in addition, ultrasound, if you really think that, we are not getting a clear picture. So, but then what happens? So this is what in the research scenario, I'm not going into details. These are the different areas I'm trying to tap into, so that bringing into the limelight, what is actually happening in the US. What are the reasons why we are getting late detection, and also why the cancer is progressing. So, and this was one of the reasons that we figured out. Now, but what happens to the younger women, right? Because in our support group, in our BCH support group, or when many women reach out to me, most of the time I find that they are very young, like 35, 37. This is a very recurrent age that I'm seeing. But what do we tell them? And also, when in urban India, when I thought of first starting breast cancer, my point was that if I'm going to these different places and I'm using this big versus mammogram, this will never work. So I have to give a solution. So that's when I felt that whatever the doctors are doing, the clinical breast exam, in the same way, we collaborated with the Sarah Cannon Cancer Institute breast oncologist, and Male Breast Cancer Coalition. And for the first time, we brought a breast cancer self breast exam card for men and for women. And this is in a very simple way, like how we can save ourselves. And this is the simple step that you need to practice at home. Now, when doing that, my concern was that, I'll talk about it, like if I'm going to the villages and I'm giving it out in English, this will never work. So I'm so thankful to our Breast Cancer Hub volunteers for helping me to translate this. Now we have it in 24 languages, and this works like magic. But then how to do the breast self exam? Is it that, I suddenly remember today and I'm going to start doing the breast self exam? That shouldn't be, that shouldn't be the case. So how do we do it? Basically, 7 day post our menstrual cycle. Like if we start our period today, 7 day from today, we have to do a breast self exam. Now, and for the women who hit menopause, and for the men, we just pick a date in the month and we do the same practice the next month, the same day. Now, in a sitting position and in a sleeping position, many breast cancer survivors told me that, like the heart floor worked very good for them. So what do? We stand in front of the mirror, we take our hands behind our head, and we look for any abnormality, any discharge from the nipple area, any swelling around the nipple area, any parts like any redness, any pimple, inverted nipple, like if there's a sudden change, sudden inverted nipple, then skin irritation or dimpling of the skin. Like for example, if you know the orange, like the skin of the orange is dimpled, so something like that suddenly happens, or redness, scaliness, or thickening of the nipple area. So these are the concerns. If you feel something like that is happening, immediately report to the doctor. The next thing is we take our hand behind our head and we start to examine from top to bottom. We have shown this in an arrow, but we also have to remember that the collarbone area and the underarm area, which is very important. When we are talking about breast self exam, it's just not the breast area, but the full chest area. We really examine it very well. And what do we expect? If you're feeling something like a marble, like a mustard seed marble is slipping from a finger, so do not panic, because 95% times it will be benign, which is non-cancer, but 5% times if it is cancer, it's always better to be safe than sorry. So we just wait for a few days, and if we see that no, the symptoms are not going away, the lump is becoming sturdy, we immediately report to the doctor. We go, if we are young, probably they will do the ultrasound, and then we do the imaging. If we have dense breast, we have to do additional ultrasound. So this is the protocol, and this is saving innumerable lives, because we have different proof, like for example, in India, this works like magic, because wherever I'm going, for example, this is in Hyderabad, this is in Chennai, this is in Assam. The breast self exam card in the local languages, women love it, men love it. The other thing is taking accountability, because I do not believe just going and giving lectures, because everyone should be able to reach out to us. So I give my WhatsApp number to everyone. That works very well, because WhatsApp is free all the time. And then but those who can email me, they have my email addresses. And the villagers will not have the phone, but the organizers have the phone, so they have my number. They reach out to me, I navigate them towards the hospitals, so that if they're below poverty line, then the government aid comes in. But to the diagnosis stand, we try from Breast Cancer Hub to help them even with the diagnosis part. So this also works very well in the US, in Africa, because in the US, these outreaches are done mostly, as I said, by our community leaders who are the students. They are talking about the early detection, the screening processes, and then of course, like, we take accountability. We work in the shelters in the US, and we work, so basically, connecting to the healthcare system, where I'm working with them so that these patients can get treatment very well. Now, this was about the screening process. Like, now we know that what are the different screening. Basically, if clinical breast exam, we have to go to the doctor and do the breast exam every year, once in a year. We have to do a breast self exam every month from the age of 17 to 18. We have to go for a mammogram. If we have dense breast, we have to do additional screening. For the high risk population, we have to do the screening earlier. And that is the key, because early detection is the key to saving lives, because the stages of breast cancer are stage 0, stage 1, stage 2, stage 3, stage 4. From stage 0 to stage 3, we can cure the patient. But if it goes to stage 4, it becomes very difficult. That means the cancer from the breast, it has spread to the distant organs. So, but from stage 0 to stage 3, we can cure the person. So it's important that we detect, and the earlier the stage is, the better it is. So that was the screening, and now I'm sure you are empowered to know how to do it. Please download the breast self exam card and share it in your network, so that you can also take step up to help save lives. And then from now onwards, after the screening process, I'm going to talk a little bit about palliative care and the importance of the support group. Now, this is a story in a village in Assam, and I'll wrap up in another 10 minutes for sure. So this is a village in Assam. Like, when I went, someone told me, like, we have a stage 4 breast cancer patient, and we lost this woman now. When I went, I saw that, she was lying on the floor, and her family was isolated her totally. So what I felt then, what they knew was cancer is contagious. So this small information, what I tell the doctors now, that when you're talking to the families, talk to the caregivers, because they have no clue what cancer is. And that is the counseling that we are trying to do in the villages we adopted, plus also, even in the urban sector. So for her, we took her to the bed and gave her comfort. But most importantly, I told the son and the daughter that this is not true. And then, after months, they hugged her. And that one, the smile that she gave me was my biggest reward. We lost her, but she knew that she died in the arms of the family. Now, this is important to know, because the concept of palliative care is significantly missing in many parts of the world. Because when we think of palliative care, we think it's at the end stage. That's not true. It should start from the beginning with any diseases, any chronic disease, and of course with cancer. Now, when I tell this story to many places, many breast cancer patients told me that, you are talking about the villages, Dr. Lopa. I am a breast cancer patient. I feel the isolation. One lip cancer patient told me, I am a survivor for 5 years, but I can feel that, when I go to someone's house, they are hesitant to give me a cup of tea or water. That is so unfair. So what happens is, when we are detected with cancer or any diseases, the bridge is shaking, and we need to give that support. And the support shouldn't be only coming from oncologists, from anyone like friends, but it also, the most important role who play are the support groups. So that's why, while I was going through all these places across India, I felt that many women told me, what is a support group? And that's where regionally we have, like in the villages, we have developed many support groups, but also we have and I have the pictures of those who've given me the permission. So we have very close a WhatsApp group, a very private WhatsApp group, and our health heroes who are going to talk today, Anusha and Laura, they are integral part of the WhatsApp group. And the amount of support they give to each other, me as a scientist, there are oncologists in the group, we cannot do the medical touch that our survivors do to the patients. So the support group is so important. And like, for example, while talking about support group, I just want to touch base a little bit about the story of Christina, a very good friend of mine. And she felt, so the reason why I bring her story is, she detected her lump through breast self exam. That's why this particular paper is not just a paper, it's a lifesaver. And what she told me was that who gave her the strength? Her kids, because they would wear this t-shirt, strong like mom, and they would come in front of her, and hers was an aggressive type, but she told me that, Lopa, I couldn't fail because my kids were my biggest strength. So many times I find that a lot of many moms are hesitant to discuss anything with their kids. Don't do that. Your kids are your greatest supporter, and when they're with you, no one can stop you to fight cancer or fight anything. In the same way, Jessica, she did her breast self exam and found her lump. And the other, the taboo and myth we have is when we are detected with cancer, our life is over. Many marriages I have seen to be broken in India and even in the US. But this woman is such a brave heart. When she was going through her chemo, she got married the day her marriage was fixed. So what I'm trying to say is everything is possible. Cancer is curable when detected early and treated accurately. And that's the strength of the support group. Now, I'm not going to go into these slides. I'm just talking about the villages we adopted, going door to door. We take care of everything, like, because these people are so poor. For them, food is the priority, not the like treatment. So we take them to the hospital, make their treatment, make sure they're getting treated, then counsel them. So we are very proudly, we can say that from zero awareness, now this 11 villages are 100% aware, and not a single person is detected late. So BCH is the pioneer to do this in India, going door to door and helping the women and men, of course, with all the type of cancers that we branched out. And we also help with the financial aid, whatever little revenue that we have, because with us, 100% goes for the cause. Now, that was the screening, and I'll just touch base now with the key risk factors with breast cancer and other types of cancers. So coming from screening to palliative care or to the support groups, and that's when the early detection is the key. We understood that, but then prevention is always better than cure. Now, one important thing that I want to bring up that we always ignore is inflammation. That means that my work on arthritis and breast cancer, like I discovered the mechanism that when we have arthritis, which is the inflammation of the bone, and if we have breast cancer, the metastasis is significantly, the prognosis is bad because there are many pro-inflammatory cytokines that are counteracting. Now, the reason why I bring it up, because when we have cancer, and if you are having any other inflammatory condition, we always ignore that. It acts as a fuel in the fire. So please don't ignore that, because inflammation is really like it helps in the progression of cancer. So please combat that inflammation. Other key risk factors, family history, I have already mentioned, radiation, the UV, then the environment, occupational hazard. Then most importantly, like three important things I always say is tobacco, because tobacco smoking is also leading to high risk with the breast cancer scenario in the younger population. Then the lack of exercise, because a lot of times now, as CWC Forum focuses on lifestyle with the music therapy and all of that, is so important, because exercise plays a very significant role to boost the immune system, to decrease the stress level, because stress is also another reason which kind of, with the different upregulation of different oncogenic signaling pathways. So all this, so basically when we think of prevention, it's multidisciplinary. We cannot just ignore one thing and we say that, okay, I'm exercising daily, but I'm also smoking. So that wouldn't work that way, right? So we have to take care from all angles. We have to take care of our weight also, because overweight, obesity also leads to underlying inflammation. Consumption of alcohol leads to underlying inflammation, which are all finally giving rise to the risk of breast cancer or any type of cancer. Now, one very important thing is the postmenopausal, hormone replacement therapy, which usually when we hit menopause, many times women are given the HRT treatment. So I would request that please check with your doctor, because now we are seeing that in the long run, the usage of the hormone replacement therapy may also lead to the risk of developing breast cancer. So these were the key things, but most, of course, like 30 to 50% of the cancers can be prevented if we take care of all of this. But most important, as Dr. Padma initially was mentioning, that the lifestyle, the diet, because what happens is that if we think in a scientific way, inside our body, there are free radicals generated, and these free radicals will go and damage the DNA of the cell. And which kind of like, when the DNA is mutated, of course, it leads to the abnormal division of the cell, leading to the tumor. But antioxidants will help to balance the free radical, and so that it stabilizes and is no longer available to go and damage the cells. Now, who provides these antioxidants? Exogenous, endogenously inside the body, there are many mechanisms. Food also helps. So when we think of food, and if we are thinking of a developing country, we will not find berries and all of that there, but we know that we are living in turmeric, like turmeric, which is the byproduct of turmeric, curcumin. When we have it with pepper, it really helps as a very good adjuvant. Now, I'm not saying that, if we have turmeric, it's going to cure cancer, because then no Indians would have had cancer, because our diet is rich in turmeric, but it helps as an antioxidant. Fresh ginger, fresh garlic, fresh onion. What we are seeing is that now a lot of times we are using so much of paste, because of our life is so busy. We try to go with the shortcuts. But I always say that our Indian spices are so good. Let's just take advantage of it. Even in the US, we can just make it, quickly in the grinder. Make those spices, just use it in your curry, use it in your day-to-day life. That really helps, because these are rich in antioxidants. So this was about the inflammation. These are different food that carbs inflammation. I just touched base, but food aggravating are the sugar, saturated trans fats, omega-6 foods, and refined carbohydrate, all of that. But most importantly, what I want to say is that lifestyle definitely plays a very important role. But then a lot of women told me that, Lopa, I did everything right, but why did I have breast cancer? The answer is we do not know. There are significant things which are still missing, but whatever is best to our capacity, we need to do that, because when we have a healthy lifestyle, even when we have cancer, at that point it becomes easier for us to understand, and to take the treatment, which is very aggressive. That way it becomes easier for us with our immune system to fight with the treatment process also. So this was about the breast cancer, the full scenario, the full picture. And I just had a slide about all the other types of cancers. I'm not going into detail now, but I want to tell everyone that from Breast Cancer Hub, we have actually generated early detection cards for all other types of cancers, where we give all the signs and symptoms, which are alarming. And we also have like what next, like if you're feeling the symptoms, what you have to go and tell the doctor. So basically advocating for your own health. And this cards, please download it, because mostly for every cancer, the signs are there, but we miss it. And because of which we are detected late. So please don't do that. Download the cards and circulate in your network. So I think I'm running out of time, but Dr. Padma wanted me to mention about the students. So I just wanted to show a few slides, like how in the US, I'm mentoring many students, and even in India and other countries too, where they are the torch bearers, and they will lead the efforts, about early detection and prevention of cancer. So basically, I always say that when a lot of people ask me, like, how do you differentiate, Lopa? So we say that, Breast Cancer Hub doesn't have to differentiate, because we are fighting for the cause of cancer, which is much bigger than any uniqueness. So why can't we just come together and work for it? And that's why I'm so thankful to CWC Forum today for inviting me, Dr. Padma, Somnath, Somya, Vidyangi. Thank you for moderating the session, and especially Radha for connecting me to CWC. And thank you everyone for listening me today. I hope you will take it home and practice all this, whatever I have said, the information. Thank you so much.